What does depression feel like? Depression is a serious mental illness that can interfere with a person's life. It can cause long-lasting and severe feelings of sadness, hopelessness, and a loss of interest in activities. It can also cause physical symptoms of pain, appetite changes, and sleep problems. Symptoms and causes of depression can vary widely from person to person. Gender may also play an important role in why a person is affected by depression, and what it feels like to them. How depression feels. One of the common misunderstandings about depression is that it's similar to feeling sad or down. Albeit numerous individuals with gloom feel bitterness, it feels substantially more extreme than feelings that travel every which way in light of life occasions. The side effects of melancholy can keep going for quite a long time or years and can make it troublesome or difficult to continue with day-by-day life. It can disturb vocations, connections, and day-by-day undertakings, for example, self-care and housework. Depression may feel like there's no delight or bliss throughout everyday life. An individual with despondency may not appreciate things they once adored and may have a craving for nothing can satisfy them. Fixation or center winds up more diligently. Settling on any sort of choices, perusing, or sitting in front of the TV can appear to be exhausting with melancholy since individuals can't think obviously or pursue what's going on. Everything feels miserable, and there's no real way to feel much improved. Discouragement may make an individual vibe that it's absolutely impossible ever to feel great again. Confidence is frequently missing. Individuals with sadness may feel like they're useless or a disappointment at everything. They may harp on negative occasions and encounters and be unfit to see positive characteristics in themselves. Dozing might be tricky. Nodding off during the evening or staying unconscious throughout the night can feel about unthinkable for certain individuals with dejection. An individual may get up ahead of schedule and not have the option to return to rest. Others may rest excessively, yet at the same time wake up inclination worn out or unrefreshed, in spite of the additional long stretches of rest. Vitality levels are low to non-existent. A few people feel like they can't get up, or feel depleted all the time notwithstanding when getting enough rest. They may feel that they are too worn out to even consider doing basic day-by-day assignments. Nourishment may not appear to be appealing. A few people with gloom feel like they would prefer not to eat anything, and need to compel themselves to eat. This can result in weight reduction. Sustenance might be utilized as a solace or adapting instrument. Albeit a few people with sadness would prefer not to eat, others can gorge and want undesirable or solace sustenances. This can prompt weight gain. A throbbing painfulness might be available. A few people experience cerebral pains, sickness, body throbs, and different torments with sorrow. Common causes and risk factors. There's no pleasure or joy in life. A person with depression may not enjoy things they once loved and may feel like nothing can make them happy. Concentration or focus becomes harder. Making any kind of decisions, reading, or watching television can seem taxing with depression because people can't think clearly or follow what's happening. Depression can be caused by a number of factors. Though a single cause cannot always be found, experts recognize the following as possible causes. Genetics, depression and other mood disorders can run in families, though family history alone does not mean a person will get depression. Life events, major life changes and stressful events may trigger depression. These events include divorce, the death of a loved one, job loss, or financial problems. Hormonal changes, depression and low mood are often associated with menopause, pregnancy, and premenstrual disorders. Certain illnesses, anxiety, long-term pain, diabetes, and heart disease may make someone more likely to develop depression. Depression is a symptom of bipolar disorder. Drug and alcohol abuse. In some cases, drug and alcohol abuse may cause depression. Other times, depression may cause a person to start abusing drugs or alcohol. Some medications, certain prescription medicines may increase the risk of depression. These include some high blood pressure medications, steroids, and some cancer drugs. Depression and women. Research suggests that the causes of depression may be different for women than for men. Researchers propose this is expected to: natural components, social desires, contrasts in understanding. Women's hormone changes may also play a role in how and when depression affects them. Women who have a family history of depression may be more likely to experience the onset of depression. Women with discouragement have progressively extreme side effects during the premenstrual period of their cycle, regardless of whether they are now taking antidepressants. Post-pregnancy anxiety happens in the wake of conceiving an offspring and influences 1 out of 7 ladies. During the menopause change, a lady's danger of despondency increments. Ladies have a few times more serious danger of getting depression during this time, regardless of whether they never had sadness before. Depression and men. Drug abuse, childhood sexual abuse, prior history of depression, major stressful life events. Symptoms of depression in men may also be different. In spite of the fact that it is ordinarily believed that women experience the ill effects of wretchedness more much of the time than men, the examination proposes that people may both similarly experience the ill effects of sorrow. The distinctions in side effects and what men report to their specialists may make discouragement harder to analyze in men. Customary indications of discouragement, for example, misery and crying, might be all the more as often as possible covered up or not revealed by men. Some may feel that these side effects conflict with society's concept of taking care of business. When to see a doctor. Those who are experiencing symptoms of depression should seek medical assistance. Depression can worsen without treatment and affect a person's quality of life. A family doctor or emotional wellness expert will examine treatment choices to enable the individual to deal with their sorrow and continue with everyday life. In serious cases, misery can prompt contemplations of suicide or physically hurting oneself. Any self-destructive considerations or proclamations about not having any desire to live ought to be paid attention to. In the midst of emergency, an individual should look for assistance from a clinic hospital department. Thanks for watching.